Okay, here's everything you need to understand what's going on in the Republican Party right now. In 2012, the Republicans got their butts handed to them, the sort of electoral drubbing that occasions a lot of thumb-sucking, think pieces, and self-reflection about what went wrong. And the basic consensus coming out of that was the party needed to do better with emerging demographic groups, Latinos, young people, those groups that are making up a larger and larger share of the electorate. It's all pretty straightforward. But here's the problem. Each second that ticks by and every day that passes puts us further from the memory of 2012 and one day closer towards the midterms, and one day closer to the beginning of the 2016 Republican presidential primary. Which means as I speak to you, as the moments flutter by, the incentives are slowly shifting so that your average Republican politician, concerned chiefly with his or her political future, cannot help but conclude that the smart, logical, rational thing to do is to pander by any means necessary to the increasingly self-lathering conservative base. And what the base wants is what they already want. Death to Obamacare. No matter how many people have to politely explain to them that ship has sailed, no matter how many Republican Party elites and donors and others warn them that threatening a shutdown or a default over defunding Obamacare will be an unmitigated disaster politically, not to mention for millions of people, though really who cares about them. They want it. They want it. And the loudest voices they listen to want it. And so today, we have the Heritage Foundation unveiling its 9-city tour intended to drum up support for defunding the president's signature piece of legislation. Meanwhile, a former Republican operative now says his own medical struggles have changed his views on the legislation. Clint Murphy, who worked on John McCain's 2008 campaign, has battled cancer and other issues, including sleep apnea. Those experiences have prompted him to turn from Obamacare adversary to supporter. When you say you're against it, you're saying you don't want people like me to have health insurance. But of course, here's the rub. Clint Murphy isn't going to get a hearing with the relatively small, committed group of dead-enders who the Ted Cruzes of the world need to cultivate support with to be plausible 2016 GOP nominees. And the defund Obamacare train rolls on faster and faster, gathering speed with every passing moment, headed towards a collision with political reality and millions of sick and anxious people. Joining me now is Avik Roy, a former member of Mitt Romney's Healthcare Policy Advisory Group, author of The Apothecary, the Forbes blog on healthcare entitlement reform. I want to show you what Ron Paul said about the government shutdown, because it was so indicative of this problem to me. He basically, here's on Fox News saying, it's a bad idea, we'll do it anyway. Check it out.
Well, I don't think shutting down the government is a good idea, but I do think that we were elected, conservatives were elected, to try to stop this overreach, this government takeover of health care. If we do nothing, we're just saying to the president, hey, you get your way.
Is there any way? You are in this lonely class of people, conservative wonks. There's like a little bit of
light explainers, we might call them.
Yeah, you're just in this little world, and I think you do your work with intellectual integrity. I think you believe in what you believe in. You actually are, you know the literature. But the Avik Roys of the world, like the Republican base, is not reading The Apothecary. They're not listening to whatever you say about, like, here's the way to actually fit Obamacare so it looks more conservative and actually gets people the health care they want. They want to burn it to the ground. Is there any way to convince them otherwise?
I think that even Mike Lee and Ted Cruz and those guys, why are they pursuing the shutdown strategy? They've said it's because once the subsidies for Obamacare start, then there's no turning back. Jim DeMint had an op-ed in the Wall Street Journal. He said we're rapidly approaching the point of no return with Obamacare. So if we hold them to those statements, then...
But here's what I don't understand about that. If the program is as much as a disaster as people on the right are warning it will be, then I don't understand why letting it to actually be implemented won't be self-refuting, right? Even if the subsidies kick in and the whole thing is as poorly engineered and poorly executed as everyone on the right is telling me it's going to be, well, then it'll be a big policy disaster and the president's going to take a political hit and the Democratic Party will, and they will deserve to if it actually doesn't work for people. So why not just let that go forward?
Some people have that view that that's exactly what should happen. But of course, a law can be rewarding for some groups and punishing for other groups. It's not necessarily uniform in its effects, right? And so I think the concern of a lot of people on the right is that, well, there will be some people who benefit, the people who benefit from the insurance subsidies in particular, but the people who aren't qualified for those subsidies, who might see premium increases despite the law's efforts to do otherwise, those are the people who are going to be concerned, and it will be a train wreck for them.
But if it's train wreck for them, like, if it is a train wreck for them, if you want to have a political cage match between two kinds of voters, one is someone who is making just above poverty, working class person who qualifies for a subsidy, and one of them is a person with a lot more money who just saw their premiums jacked. Let me tell you who's going to win that political cage fight. If the concern is about the politics of this, it's going to be the upper middle class person who saw their premium jacked, who's going to make their representative scream bloody murder in Washington, D.C. My feeling is this isn't about policy, right? It's about destroying the president, or it's about taking a chunk of his hideout, or it's about just saying across this line you shall not pass, as opposed to improving it.
It's definitely not that. So there is a view. The view among the base, I think the typical view of a base voter for the Republicans is we had a free market health care system before Obamacare was passed. Obamacare was passed. It was a government takeover of the health care system, and that's what we've got to stop, because if we don't, then we've lost the war against big government.
I must interject that neither of those things are true. We did not have a free market system before, and this is not a big government takeover.
That's their truth about it. I was simply
that is what they
reflecting.
Right.
Yeah, so I think that's exactly the thing. And so what I try to do when I'm the polite explainer is to say we actually had a heavily government-involved system to begin with. We've had one since at least 1965, possibly before, arguably before, and the Affordable Care Act is an incremental advance of that, but it's not the government takeover. You know, if you can't look at it in isolation, you have to look at this whole, 8-year trend.
What do people say to you when you say that? Do you get traction as being a polite explainer?
They are persuaded, but I'm doing so in relatively small audiences, not to hundreds of millions of people, right? So, but I think when you show the data is very clear. If you look at, for example, government spending on health care in the United States, it's the fourth highest in the developed world, fourth highest in the world, therefore. Right. There's only 3 countries in the developed world that spend more in terms of public spending per capita on health care than the United States. And that's in 2010, before the
Affordable Care Act.
So when I explain that, I think people start to scratch their heads and say, you know what, you're onto something.
All right, I want to talk about what is the path from talking to a small amount of people to millions of people for the conservative wonk Avik Roys of the world, and wonk Ezra Klein's going to join me, and we're going to script to you a strategy to get you out of this little box right when we come back. All right, joining me now is the editor of the one and only Wonk blog at the Washington Post, MSNBC policy analyst Ezra Klein. Ezra, I wanted you to respond to Avik, and this is my question to you, as someone who follows this incredibly closely. Is there enough time to bridge the gap between perception and reality of what the Affordable Care Act is and represents in American politics in time to avert something disastrous and catastrophic this fall when possibly Republicans try to force some kind of shutdown?
I question your premise, sir.
Please.
Look, I don't think that bridging the gap matters that much. So, number one, to the Republican shutdown threat, it's not going to happen. They don't have the support for it in the House. The sort of elders in the Senate, the more rational minds in the Senate, clearly seem to be triumphing. I would be very surprised. It doesn't mean it can happen, but if I were placing my bet now, I would put a very, very, very low probability on a Republican-led shutdown over Obamacare. I just see it as fairly unlikely. Now, maybe this prediction will have egg on my face in a couple of months, but there it is. The secondary part is about bridging this sort of broad perceptual gap, something that I think Avik often contributes to, as much as he's a good guy and a wonk. I think that it would be fair to say he emphasizes the negative and doesn't always give a particularly balanced portrayal of the law. But in a broad sense, I don't think this political conversation over the law matters very much. Come October and come the months after that, we are going to see the actual law begin. And most people will never interface with something called Obamacare. In California, they will see this thing called Covered California. In Washington State, it'll be, I think, the Washington Health Connector or something.
Wait, but
it will either work for them and be affordable for them, or it won't be. But it won't be about the political conversation.
That I somewhat agree with, which is the point I was trying to make to Avik, right? Like, let it play out. If it's as bad as you say it is, then won't it be terrible for the president? But I do think this. I do think that there is a way that kind of narratives of disaster do get caught up into the media universe. And Ezra, particularly because so few people will interface with actually the thing itself, it does seem to me it would be possible that a media narrative of disaster does get created, aided and abetted by people who actively want to see the thing fail, to the point that you do create real political backlash that then does have policy consequences, because people then in Washington are trying to fix something that isn't actually broken.
Yeah, so I think one thing to bring up there is that when you pass a law on party lines, that tension, that dynamic is more present. present. If there's
Believe me, if they could have passed it with Republican votes, everyone would have loved it.
We could relitigate 2009 another time. But I think that just from an objective, from a political science standpoint, that's the challenge, right? Is that when you have one party that is opposed to the law and didn't support it to begin with and has no stake in its success, and one party that does.
Can I just say this? Except for the stake of the human beings whose lives are on the line. Well, when you have people going out trying to get something not to work, Ezra.
But wait, you at some point you have to eventually pass laws. So I mean, yes, it's true. It would have been a good idea for the party that was in power in 2009 to have tried to come to some compromise. I mean, one of the things they maybe could have done is to base their health care plan off of the health care plan passed by one of the prominent Republican presidential candidates, who Avik Roy would eventually go on to work. I mean, this stuff gets a little bit ridiculous. The Republicans refused to come to the table to even deal on a plan based on plans that they themselves had proposed earlier. I'm not saying every Republican loved every one of those plans. Clearly, a set of Republican ideas were involved in them, though. And then they say, well, this was a partisan plan you passed, so we can't support it. But look, it is completely the case, Chris, that you could have a media narrative. And in fact, I almost assure you will have a set of media narratives based off of very real implementation frictions and troubles. My guess is the Affordable Care Act will not be a big boon and will in fact be a net negative for Democrats in 2014. And then just as happened in Medicare Part D, which was a very tough bill and a very tough rollout in its first year, as the bill gets on its feet and begins delivering a fair number of benefits, then I think the fears of Jim DeMint and others actually become very important, because it does become essentially impossible to repeal, although it doesn't become impossible to reform or improve.
The Morning Consult did a poll where they showed that if you ask people, 1,000 likely voters, what do you think is the biggest problem with the healthcare system in America? 75% it was the cost of insurance. 11% said it was the uninsured. And so, will the Affordable Care Act make insurance less expensive? I think a lot of the evidence...
It's a big outstanding question. The other thing about that, though, is if people don't care about the uninsured, and it's possible people don't care about the uninsured, there's still tens of millions of people who are living through absolutely unnecessary misery, and I care about them. And I think a decent social contract and a decent society should care about them. And I'm happy that we're all in this together, and we're going to get some of those people health insurance. Avik Roy, author of the Forbes blog, The Apothecary, MSNBC policy analyst Ezra Klein, questioning my premises. Thank you very much.